Dr. Lucas Marchand, the house called Chiropractor here in Sioux Falls, and we're going to talk about chiropractic adjustments and what exactly an adjustment is doing. So all we're doing with the adjustment is we're finding joints that are stuck in the spine or sometimes in the extremities, like in your shoulders or your elbows or your wrists or your ankles or your knees. And we're finding areas of what I call aberrant joint motion. They're just not moving properly. And we're delivering an adjustment to that area to get the joint to move properly. There's a couple of ways to do this. You can do what is the most common, at least most common type of an adjustment, which is a high velocity, low amplitude thrust. These are the type of adjustments you might see on YouTube, TikTok, the ones that get the popping, the cracking, that popping going on in between the joints. Isn't a bone on a bone or anything. It's just gas going off in between the joints. And when the joint moves, it goes from a liquid state to a gas state, creating that pop, and that's what's going on there. In fact, sometimes I'm even looking for that feedback with the popping, because then I know for sure the joint's moved. Now, we don't necessarily need to have that popping or some thrust type of adjustment. We can use something like the activator, the clicker. We can use drop tables to assist us in the adjustment. It doesn't take much to move the spine, so an activator works just as well. Usually after an adjustment, three things typically happen. Some people feel about the same, and some people feel great, almost instantaneous relief. And I'd say 10% of the population actually feel a bit worse after their adjustment, and that's totally normal. People are in between with that, where they feel about neutral or a little bit better after their adjustment. I tell my patients, give it an hour or two, use some heat for 10 minutes, followed by 10 minutes of ice. And usually, mild symptoms will go away within a few hours. Typical care plans for me is I go visit to visit. We start out at 2 or 3 times a week for 2 weeks. We'll do a reevaluation at visit 6 or at 2 weeks, whichever comes first. In that time, I always have my patients, prior to me first meeting them, fill out this index, a Bournemouth index, where basically they fill it out, they get a score, and let's say the top score is 70, let's say they get a 40 out of 70, so they're mildly to moderately disabled. And our goal in the next 2 weeks, or in the next 6 sessions, is to go from a 40 down to a 20 or less. And then at that point, we reevaluate and we decide, let's do another clinical trial of 6 sessions to get you down from 20 to 10 or completely gone. And that's how we go. And if we're not getting better in that time, then we have to refer up the chain, maybe to an ortho consult. But ultimately, the adjustments are the foundation of chiropractic care, and they usually don't take terribly long, but you don't need to have endless appointments either. Like I said, 1 to 6 sessions over 2 weeks typically resolves most symptoms. I'm Dr. Lucas Marchand, the house called Chiropractor here in Sioux Falls, and we'll see you on the next video. Have a great day. Bye.